So we are going to start the session. Super 24. Yes, get ready. Take your notebooks, pens, and papers, whatever you want, because the sentences which I'm going to tell you are going into your OET writing and speaking tests. These are tailor-made sentences where you can fit in and you can alter shape or resize. Yes. So we are going to practice quality. We are not practicing sentences, we are practicing quality. Quality is our fundamental prerogative, without which getting success, achieving success, or targeting success, or whatever you call it, is almost a little difficult. So, Grandmaster class, writing session, quality sentences. Quality sentences. Invite your friends, and then there we are. Right. It's something called a talent. Yes. Writing, craftsmanship, workmanship. Writing, workmanship. What is this workmanship? You should know what it is first in the first place. Do you know that? If you do not know, learn it now. I'm going to show you what is the meaning of workmanship. Workmanship. It's a very special word. If you know the meaning of that, you will really marvel at it and you will learn. Yes. So, because we have completed 4,000 letters so far, officially, and many more orally. You can see the corrections, you can see the reviews. So 4,000 reviews. Thanks very much from the bottom of my heart for your tremendous support, without which it would have been impossible. Your trust in me that we will provide quality. 4,000 letters. It's not a joke. It's pretty serious thing. The figures, and maybe within this coming month, we'll make it 5,000. So with all your support once again. Right. So, thank you once again. A teacher is known by his students. Excellent students make excellent teachers. Right. So, you deserve, you need, you demand, you ask for not a mediocre teacher, but you ask for an excellent teacher. So therefore, I also ask for excellent students because they will listen and implement these things, which is very important. Implementing these things is very, very important. Fine. Follow these things on a daily basis. and practice these points. Yes, number one. Yes. Super 24. Yes. Super 24. Quality sentences. So we're getting the first one. Right. Yeah. Now what I ask you is, I want you to write any sentence you know the best one. Whichever you feel, the best sentence. The best sentence. The best sentence. The best sentence. Yeah. So the best sentence, whichever you can. Yes. Write down one sentence, whichever you know, think, imagine, and write down. I want it now. So now let us see something like the investigations. The investigations confirmed, the investigations confirmed viral influenza. Suppose, okay, the throat, we can say the throat swab. The throat swab investigations. Throat swab investigations. Throat swab investigations confirmed viral influenza type B, and an echocardiogram throat swab investigations confirmed viral influenza type B. Throat swab investigations confirmed viral influenza type B, and an echocardiogram indicated pericarditis. Now, this is one sentence. This is not the best sentence. Definitely. Okay. This is not the best sentence. I am trying to take a B grade, B plus grade sentences, and I'm trying to transform it to A grade sentences. So, throat swab investigations confirmed viral influenza type B. Throat swab investigations confirmed viral influenza type B. See there. I want you to tell me why these are B plus sentences and not A grade sentences. Or why it is B grade sentences and not B plus sentences. I want you to tell if you can. Throat swab investigations confirmed viral influenza type B, and an echocardiogram indicated pericarditis. Okay, fine. Yeah. Yes. Yeah. So now these sentences, now let us see what I'm going to show you now. Viral influenza type B was confirmed by throat swab investigations, and pericarditis was indicated by an echocardiogram. Now see, I have reversed the show. This is active voice and that is passive voice. So just what I'm doing is, Viral influenza type B, this one I am bringing forward. Then I am placing here was confirmed. Okay. Yes. Now let us see here. Viral influenza type B was confirmed. And pericarditis was indicated by throat swab investigations and an echocardiogram respectively. Full stop. You know the first one for the first and second one, second. You can see that now. So viral influenza type B was confirmed and pericarditis was indicated by throat swab investigations and an echocardiogram respectively. This is A grade sentence. Okay. Quality enhancement. Quality enhancement. Okay. So, write quality sentences as far as possible. Right. Now, yes. Now, what you can do is you can write some sentences based on this one. You can write some sentences based on this one. Yes. Write anything which you want. To think about something and try to imagine and to try to write. It's number one. Think about throat swab investigation. Write any sentence whichever you want. Investigations revealed, investigations confirmed. Okay, examination. Yes, one sentence I want from each one of you. There are three candidates. So three candidates will write three sentences. Yes, you type in the chat box whatever sentence you can think like this. You can type in the chat box. So use special words like this. Throat swab investigations confirmed viral influenza type B and an echocardiogram indicated pericarditis. See the quality there. There are two sentences actually. There are two sentences actually. Joined with and. That's it. You can see there sentence A and sentence B. Yeah. You can see the two sentences. And these two sentences are joined by and. The two sentences are joined by and. Right? Anyone like this. Try to create because these will definitely you will write in the exam. There is no escape to write these sentences. There is some problem, it was diagnosed or revealed or confirmed like that. Yes. So the first sentence is here till here. And the second sentence is here. These two are joined by and. Okay. That's what I am showing you here now. Yes. So two, one is investigation. Okay. And another one is indication. First one, this, second one, this. How you are joining to different, you will definitely get A grade. I'm not bothered about a B or pass or anything. I'm bothered about how quality you will get. Okay. That is what is important. Throat swab investigations confirmed viral influenza type B. That is one. And an echocardiogram indicated pericarditis. Number two. Joined by and. So, first one, throat swab investigations. So, this is called the subject. Now, let us see here. Throat swab investigations. This is the subject and this is the verb. Okay. And this is the object. So we have subject, verb and object. And again another one, an echocardiogram is the subject. Indicated is the verb and pericarditis is the object. So try to understand this one. Subject, verb, object, subject, verb, object, sentence, conjunction, sentence. See the wonder there. See the special style there. Yeah. Yeah. So, I want you to prepare a sentence like this. One sentence like this. Come on. I'm giving you time because this sentence definitely, if you write in your exam, the person who is correcting your paper will be, surprised or shocked. Yes. This is the verb. This is the verb. And here this is the verb. So verb and verb. And subject to verb object. The one which is before this verb is the subject. Okay. And after the verb is the object. Now here this is the object. Viral influenza type B is the object. And here pericarditis is the object. And echocardiogram, that's the subject. So the one which comes before the sentence, before the verb is the subject. Yes. Now write in your notebook first. Write in your notebook first. Now submit your sentence. Take your own time, no problem. We are learning quality sentences, I am telling you. Yeah. Quality sentences. This is still B plus only, not A grade, because it is all active voice. Both are active voice sentences. But quality is there. But if you do mistakes, you'll get B grade only. Yeah. 24 only. I'm not going to teach too many, 24 only, but definitely you'll be very happy today. Write your own sentence. Write your own sentence. Smoking cessation was recommended and alcohol reduction was advised. Like that. So two different sentences. Nutritious diet was recommended. The dietitian recommended nutritious diet, and the physiotherapist advised stretching and strengthening exercises. Write down, na? You write your own things. Write two things and put an end in between. That's enough. Nothing. Challenge. Yes. Challenge there. Yes. You can even speak into the microphone and it will type and you can correct. Now I am speaking in the microphone from Grandmaster class. The dietitian recommended nutritious diet and the physiotherapist advised stretching and strengthening exercises. And the physiotherapist advised stretching and strengthening exercises. I just read into my tab and it typed. Yeah, Neelam Chandra. Hip fracture was revealed by an X-ray, Neelam. An X-ray. And surgical intervention was recommended. Respectively will not come here. And surgical intervention was recommended by the specialist. Hip fracture was revealed by an X-ray and surgical intervention was recommended by the specialist. Very good. Yeah, come on. Come on, you learn two things together, how you are going to write. You can rewrite that sentence, Neelam. The dietitian recommended nutritious, where is your sentence? Hip fracture was revealed by an X-ray and surgical intervention was recommended by the specialist or surgeon, by the surgeon, like that. Rewrite the sentence. Okay, it's okay, it's okay. We are learning. We'll take time and learn. 24 sentences only. That's okay. But see the quality. Neelam, excellent. You have done well. Yeah, what about the others? Come on, try. I have given another sentence. The dietitian recommended nutritious diet and the physiotherapist advised stretching and strengthening exercises. Now, these two sentences can be written in passive voice. These are still B grade sentences. Nutritious diet and exercises were recommended by the dietitian and the physiotherapist respectively. That is how you have to write an Neelam, respectively. Yes. Take your time and think and write. Take your time and think and write. Think whatever you want. Two different things, but they should be related. They should be related. And you have to join with and. You have to join with and. Medication compliance is maintained excellently and dietary regimen is implemented or followed rigorously. Yeah. Come on. So we are moving to the next sentence. 2 minutes time. Yes. Very good. Somebody else written. Patient is advised to follow a restricted diet in order to treat the hypoglycemic symptoms by the dietitian. Very good. Good sentence. Neelam Chandra. But I request you don't use the word patient. Don't use the word patient. You can just start directly using a restricted diet is advised. Write down, correct the sentence. A restricted diet is advised in order to treat the hypoglycemic symptoms by the dietitian. Fine, that's fine. Yes. Yes, very good. Now we are going to the next point. A restricted diet is advised in order to treat the hypoglycemic symptoms by the dietitian. Very good. Neelam, I appreciate you. You are following the suggestions. Right. Second sentence. Second sentence. Sentence number 2. Okay. Fine. Miss Styles has hypertension, comma, diabetes, diabetes type 2, and depression, comma, managed with quinapril, managed with quinapril, yes, managed with quinapril, brackets, acupril, 40 mg twice daily. Don't write too many commas. Twice daily, comma, metformin, brackets, diabetes. If you want to learn, learn. 500 mg twice a day. Diabetes 500 mg twice a day, comma, and gliclazide, brackets, APO, GLIC, gliclazide. So now see how I am writing. Be careful. I am teaching you very special sentences. MR 30 mg daily. That is it. Yeah. Now see here. Miss Stiles has hypertension, diabetes type 2, and depression. Managed with quinapril 40 mg twice daily, metformin, diabetes 500 mg twice a day, and gliclazide 30 mg daily. Okay. So here what you can write to improve that one, even this one can be improved. Which were managed with, which were managed effectively with quinapril daily, respectively. Sorry. Yeah, that's it. Which types has hypertension, diabetes, type 2 and depression. So three of them, which were managed effectively with quinapril for the first one, metformin for the second one, and gliclazide for the third one, that is depression, respectively. So this is how you can write. Yeah. This is the second sentence I am giving you. Okay. So I don't want any color for anything. Yeah. Yes. This is the first sentence, and this is the second sentence. That's it. So this is the second one. Now learn. Right. Miss Stiles has hypertension, diabetes type 2, and depression. Managed with quinapril 40 mg twice daily, metformin 500 mg twice a day, and gliclazide dash 30 mg daily. So this is one special sentence. So learn how to write. Now write your own sentence. Yes. Write your own sentence, please. So write down your sentence, please. Yes. Write down your sentences, please. During hospitalization, diabetes mellitus type 2 was confirmed by blood investigation, which was managed by blood investigation, which was managed by no. During hospitalization, correct it, Neelam, correct it. During hospitalization, no D capital letter. Diabetes mellitus type 2, which was confirmed by blood investigation, comma, during hospitalization, comma, diabetes mellitus type 2, comma, which was confirmed by blood investigation, comma, was managed by metformin 500 mg. You should not write TDS, write in the word form. And continuity of exercise has been recommended by the specialist. Okay. So there are some mistakes, you have to correct those. Yes. Next. What about the others? Give your answers, please. 11 candidates, whether very good. Strength is increasing, very good. Asa Chandran. Okay, good. Carolyn Maria, Dinny, Divya's Galaxy, Geeta Patel, Greta, Neelam Chand, Sini Jibin, Smita Kanta. Yes. So try. Mistakes also it's okay, but write something and type and post so that I can help you. Yeah. Yes. Yeah. So write your sentence, one sentence. Think about like that. Change the name, change the problem, change the disease, change the medication. Okay. Change the duration. Finished. Change the amount. 500 mg, write to 50 mg. 40 mg, write 20 mg. Okay. Pin April, something name. Change and write. So how you have to write a brand name should come in brackets and generic name should come in outside. This is the best format which you can implement. Yes, 2 minutes more. Afterwards, I'll give another sentence. Active participation, I could not see. I'm really very sad for that. Try, na? Do mistakes. Do mistakes, no problem. Yeah. Now, sentence number 3. Yes, second sentence done. Now, sentence number 3. Yes, somebody has written one sentence. During hospitalization, diabetes mellitus type 2. Diabetes D capital letter, no small letter. Well, this is already checked. Okay, fine. Now, third sentence. Third sentence. Yes. Thank you for seeing. Thank you for seeing Miss Stiles, a 62-year-old widow and retired school teacher who requires your investigation of a possible relapse of pericarditis. Thank you for seeing Miss Stiles, comma, a 62-year-old old hyphen, it should be like that. A 62-year-old widow, comma, and retired school teacher, comma, who requires your investigation of a possible relapse of pericarditis. This is the third sentence. Medically, she has had diabetes and hypertension for which she was prescribed Acupril 20 mg thrice daily. Okay, when you are writing Acupril, directly you have to write outside only. When you are writing both, then you have to write. Okay, the generic name outside and right. Metformin, glibenclamide, spelling mistake. Okay, 500 mg twice daily. Okay, that's good. You tried. I am very happy, Smita. At least you have written one sentence. If it is wrong also, right also, not a problem. Try. If you cannot try, then how will you get? So now this is the third sentence. Now you change the name, change the style. Instead of Miss Style, write something else. Instead of 62, write something else. Instead of widow, you write something else. Instead of retired school teacher, you write something else. Okay. Instead of investigation, write assessment. Okay. Whatever you want to write, you can write. There is no restriction. Try to modify and try to write your best. So third sentence. Sentence number 3. Yes, write your sentences, please. 3 people have written some things. Let me check. Yeah, very good. Is there Smita? Yeah, I check this one. Then next one, Neelam. Thank you for seeing Mr. Patrick. Is missing. 18-year-old hyphenated. 18 hyphen year hyphen old. Neelam, correct the sentence and write down. Write down. 18 hyphen year hyphen old. It's compound noun. Compound adjective, sorry. 18-year-old student, comma, who is being transferred today back into your facility for further conservative treatment. Very good. Very good. Yes. Thank you for accepting Mrs. Maggie. Okay, who is this? Geeta Patel. Oh, one more student is started writing. Very good. Participation. Thank you for seeing Miss Smith. A 72-year-old pensioner. Corrected Geeta Patel. Thank you for seeing Miss Smith, comma, a 72-year-old, 72 hyphen year hyphen old, then remove the comma there, pensioner, comma immediately, after comma, space should be there. Space will not be before comma. Space will be after comma. Who requires continuing care and assessment of pericarditis. Okay, very good. Excellent. And Smita Kanta. Thank you for accepting Mrs. Maggie, a 25-week pregnant mother. Not 25 weeks pregnant, 25-week pregnant mother. 25-week pregnant mother. Okay. Maggie, Mrs. Maggie, comma. Thank you for accepting Mrs. Maggie, comma, A 25-week pregnant mother who requires your appropriate management and assessment for gestational diabetes following the discharge. Wow. Wonderful. Wonderful. Awesome. I like this sentence. Of course, there are one or two mistakes. That is different thing. But I like this sentence, really. Thank you for accepting Mrs. Maggie, comma, a 25-week pregnant, 25-week pregnant mother, comma, who requires your appropriate management assessment for gestational diabetes following the discharge today. Very good. Excellent. I'll correct these sentences afterwards. Don't worry. Next one. Punita Franklin Hall. This is one special student of mine, extraordinary student. Thank you for seeing Miss Ali, comma. Thank you for seeing Miss Ali, comma, who is diagnosed with gastroenteritis. Thank you for seeing Miss Ali, who is diagnosed with gastroenteritis. She requires your opinion for further investigations if needed. So, if needed, before comma is not necessary. Okay. Comma is not necessary there. Thank you for seeing Miss Ali, who is diagnosed with gastroenteritis and requires your opinion for further investigations if necessary. Correct your sentence, Neelam. Thank you for seeing Miss Ali, who was diagnosed. Instead of is diagnosed, you write was diagnosed. Thank you for seeing Miss Ali, comma, who was diagnosed past tense. Finished. Either present perfect tense or simple past tense. Who was diagnosed with gastroenteritis, comma, and requires your opinion for further investigations if necessary. Right. Next, sentence number 4. Very good. Excellent. Excellent. Things are getting heated up. No problem. Sentence number 4. Sentence number 4. Yeah. Yes. Right. Sentence number 4. Miss Bell was admitted for stabilization of her non-insulin dependent diabetes mellitus, for which she has been treated with oral anti-hyperglycemic agents, glibenclamide 5 mg daily, metformin 850 mg TDS for the past 15 years. Miss Bell was admitted for stabilization of her non-insulin dependent, like this, two hyphens, non-insulin dependent diabetes mellitus, okay, right. Non-insulin dependent diabetes mellitus, comma, Miss Bell was admitted yeah. Miss Bell was admitted for stabilization of her non-insulin dependent diabetes mellitus, comma, for which she has been treated with hyperglycemic, oral anti-hyperglycemic agents and bracket, this is bracket, glibenclamide 5 mg daily, semicolon, this is listing we call, listing, semicolon number 1, metformin 850 mg TDS, yeah, okay. Glibenclamide 5 mg daily, metformin, okay, for the past 15 years, fine, that's the sentence. Yeah, so you can write your own sentence. You can write like this, was presented with the complaints of hypertension for which he has been treated with or which has been managed with. Miss Bell was admitted with a complaint of hypertension for which she has been treated with antihypertensives dash 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 for the last 2 years. Finished like that. Yes. So fourth sentence, Miss Bell was admitted for stabilization of her non-insulin dependent diabetes mellitus, for which she has been treated with oral anti-hyperglycemic agents. Okay. So don't write TDS. Don't write TDS. Write actually what it should be written that you write for getting better marks. What I have given you is I have given you as it is from the official website, official books. You can try one sentence like this. Change the name Miss Bell. You can say Mrs. Sarah or Mrs. Lincoln was admitted, say was presented for stabilization of her non-insulin dependent diabetes mellitus for treatment of her hypertension, for which she has been treated with, for which she has been managed with intravenous some antihypertensives for the last 2 months, like that. Yeah. Yes, Divya has written a sentence. Yeah, Mr. Dash has been suffering from type 2 diabetes. Okay. Has been suffering. Don't use the word suffering. Okay, you can say Mr. X has had type 2 diabetes, hypertension, and hypertension. And two things are there. Before the first one, you have to write it. Investigation revealed that blood sugar in the morning. Investigations revealed blood sugar level of 130 by 80 per deciliter in the morning. The condition was managed with metformin 850 mg twice daily. Very good. Very good. Okay, Mr. William has been. Okay. Yeah, if you cannot write one sentence, you can write 2 or 3 sentences. No problem. That is not at all a problem. Yes, sentence number 5. Sentence number 5. Sentence number 5. She has also developed a small ulcer on her left foot, which has responded to antibiotic therapy, augmentin duofort, and daily saline dressings. She has also developed a small ulcer on her left foot, which has responded to antibiotic therapy, augmentin duofort, capital letter brackets, augmentin duo, capital letters, fort, bracket close, augmentin duofort, and daily saline dressings. Yes. So this is sentence number 5. Very good. Many students are writing many sentences. Divya D'Souza. In case of chest or abdominal pain, paracetamol can be prescribed or administered. Or if chest or abdominal pain persists, comma, paracetamol can be administered. That is it. Okay. Smita Kanta, Miss Mark, Mr. Mark was presented with chronic urinary tract infection and hypertension since 2006 and 2007 respectively, for which he was commenced antibiotics, amoxicillin 250 mg daily, losartan 50 mg thrice daily. Okay, in case of she has a chronic wound on the left thigh, which is managed well managed or managed effectively with daily saline dressing and antibiotic therapy. Flux. Okay. She has also developed a wound infection on her right hand, which has responded to antibiotic therapy. Not antibiotics therapy, antibiotic therapy. Cefixime, 200 mg BD. BD is not advised. Right, twice daily. And daily dressing. Okay. So Neelam, Jake presented with hair loss problem and anxiety when he was 14 and was referred to a trichologist. Good. Miss Styles was admitted for stabilization of her hypertension, for which she has been managed with antihypertensives for the last 2 years. Okay. Okay, good. You're doing well. The next one, sentence number 6. She will require ongoing management and monitoring of the wound. She will require ongoing management and monitoring of the wound for complications. She will require ongoing management and monitoring of the wound for complications. Otherwise, you can say this is active voice. Ongoing management and monitoring of the wound for complications will be required. Just passive voice. Yes, write more sentences, please. Right. Next. Sentence number 7. Yeah, next sentence, question number 17. Although she has a number of family members living nearby, their support is irregular and Miss Martin may be at risk of social isolation. Although she has a number of family members living nearby, their support is irregular and Miss Martin may be at risk of social isolation. Yes, write one sentence. Although she has a number of family members living nearby, their support is irregular and Miss Martin may be at risk of social isolation. See the sentence, see the quality. Okay, and when you write about social history and life and other things, Mr. Martin, Mr. Martin, Mr. Martin has never married. Mr. Martin has never married, comma, is financially independent and lives in her own home. So three sentences are there in this. Mr. Martin, sorry, Miss Martin Miss Martin has never married, is financially independent, and lives in her own home. Smita Kanta, he requires round the clock monitoring, round the clock, round hyphen the hyphen clock, round the clock monitoring to manage his high blood pressure and hypothermia. However, good progression has been observed. Divya, she requires appropriate medical treatment. Is no need. She requires appropriate medical treatment and management for the above mentioned condition. Very good. So we have covered 1/3 of the 24 sentences. So 3 days. Today 8, tomorrow 8, day after tomorrow 8. 3 sentences. I will give you now. Next day you have to write and submit me. Yeah. Very good, Smita. You are transforming into passive. Very good. So now let us see. Carolyn Maria. Everyone can unmute. Carolyn Maria. Hello, Carolyn. Okay, Smita.
Yes, sir.
What
Hello,
you
sir.
trying?
So here it's 5:20, 5:10 p.m.
Okay. So now tell me, what I'm asking, are these sentences useful for you?
Yes, sir. It's very useful, and I like
Don't
this
you
kind
think,
of section.
don't you think these sentences will enhance your quality?
Yes, sir. Definitely, sir.
So every day I'll give you some sentences personally, not like this everyday class. I'll
Okay.
send and you can practice those sentences and use them in your letters. Okay.
Okay, sir. Okay, sir. This
Okay.
is very useful session, sir.
Yeah, you
Really, I
can
like it.
modify and you can write, no, based on some
Yes,
standard
sir.
examples.
Yes, sir.
Okay. Next, Divya D'Souza.
Hello, good evening, sir.
Good evening, Divya. How are you?
Fine, sir. Thank you, sir.
Yeah. You are trying to improve, work hard very much, but still there are some mistakes. No problem. But quality is improving. Earlier, how it was and now how it is. Don't you see the transformation and change and improvement?
Yes, sir. It is very
Okay.
beneficial, sir.
Huh?
It's very beneficial, sir. Sentences.
Today I taught only 8 sentences, but am I making you think or not? Each sentence 5
Yes, sir.
minutes, even if you take.
Yes, sir. We are thinking and ready. It will take time. Sir.
Yeah, very good. Thank you very much. Next one, Greta. Hello, Greta. Okay, Gideon. Hello,
Hello?
Gideon.
Yes, sir.
Yeah, Gideon, how do you feel these sentences?
Yeah, they are very powerful, sir. Hello?
Yes, please, go ahead. Tell me, what are the benefit of these sentences?
They are so beneficial to me because they explain the background of the patient in the introduction. They are very quality. They are
They are
complete sentence.
time consuming, but benefit for us. So practice them.
Okay, thank you very much, sir.
Right. Dinny. Hello, Dinny. Yeah, Greta and Carolyn. Okay, fine. Right.
Hello, good evening, sir.
Yes. Yes, Dinny. What's your name?
I'm Dineo.
Linio.
Yes,
What's your full name?
Dineo.
Okay. Where are you from?
From Lesotho.
Okay, you are the new one. Okay, Mr. What's his name? He referred the same one.
Ernest. Ernest Ndahan.
What's your full name?
Dineo Buhluku.
Okay, fine. So that's good. And yeah. So today we have learned some sentences. How far are they useful for you?
It was not easy to follow, but I was just listening and
Okay, stressed
check
in
on
listening and reading.
writing.
Okay.
Yes, so and try to to write something, but I couldn't be confident enough to write.
Okay.
On- but I didn't follow. Let me say, I didn't.
Yeah, this is little higher level. This is little higher level for those who are going for the exams. No worries, but
Okay.
you can just break them into pieces and start learning. No worries. Okay.
Okay.
Okay. These are higher level exam going students, last minute sentences. So now I gave. So normally it will not be this high. So you will be able to follow from next class onwards. Okay.
Okay.
Okay, dear.
Thank you.
Okay. So good night, all of you. Have a nice day.
Good night.
Good night, sir.
Good night.
Remain blessed.
Yeah, thank you very much.
So,